CCS 101.1 FM, AM 1160, WCCSradio.com. Dr. Imran Bajwa is with us here this morning from the Indiana Regional Medical Center as we talk about a very serious subject, and that is lung cancer. Maybe we don't think as much about it because we appear to have we've made strides in the battle against smoking, but smoking can be one of the causation factors for lung cancer. There can be others. We want to talk about it with him. Our conversation brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. How are you?
I'm well, thanks.
It's good to have you
How
with
are
us.
you this morning, Tom?
Wonderful. Absolutely wonderful. So lung cancer, there was actually Lung Cancer Awareness Day earlier in this month.
Yeah.
We didn't get a chance to, I don't know if you celebrate a day like that or not, but you certainly do mark the fact that there is a day when we want to call attention to it. We're calling attention to it today. Lung cancer is really, really dangerous and deadly, isn't it?
Absolutely. Prior to the advent of some of the recent immunologic agents, the 5-year survival rate of lung cancer diagnosed after stage 1 was about 5 to 10%.
Yeah.
And now, with, as you said, the decrease in smoking, that's finally starting to show dividends.
Should we be worried, though, about the onset of vaping and what it can do to us? Is there research out there yet indicating that vaping is harmful as well?
It's a great question, and the short answer is no. There's not enough research yet.
But they're doing it.
Well,
They're certainly looking
there
into it.
are a couple of studies, but you start out with small cohorts for a study, a small number of people, and you gradually increase that. So, I mean, there are, of course, enough people vaping that it shouldn't be any problem getting a large number of people for a good powered study.
Yeah, those studies take a while, of course. You want to study long-term. Short-term studies have their values as well. Let's think about lung cancer and how people come to contract it. We mentioned smoking. That is obviously a major cause of it, but there can be other factors as well, can there not?
Absolutely. Secondhand smoke accounts for maybe 1 to 2%. Secondhand smoke causes the small incidence of cancer mostly in women, and we don't know exactly why. Other causes, asbestos, silicosis, small incidence. So I don't think one should misunderstand that exposure to asbestos, and we're talking exposure to raw fiber that can be inhaled, not asbestos that is in the ceilings and is not dropping through. If it's well contained, that's not an issue. Silicosis does have a somewhat higher incidence. When you add smoking to silicosis, then you're talking about a 20 times higher possibility of getting lung cancer. So radon, a small incidence of lung cancers. It had been blown out of proportion during recent years. So the thing is that, yes, it should be monitored, but not everyone should go out and start getting radon detectors for their house.
Yeah. Okay, so all of those different factors that can lead to lung cancer, what should we be doing in a general sense in terms of screenings for lung cancer, of looking for symptoms for lung cancer? What are the symptoms that we should be looking at?
So the symptoms are the problem. By the time you develop symptoms, the horse has fled the barn. And then we're talking late-stage cancer, either because of size or because of spread to either the other lung or elsewhere in the body. So symptoms is absolutely not something to wait for. However, symptoms, coughing up blood, being short of breath, having pain in the bones, that indicates stage 4, the last stage, widely spread, including spread to the bone. But the key now is that after a very large-scale study, we now know, we now know that screening with a low-dose CT of the chest on a yearly basis. And the Medicare criteria for that is someone with greater than 20 pack years of smoking, and I'll say in a second what pack years means, who are either current smokers or have quit no longer than 15 years ago. 50 to 80, there is sort of a mandate, if you would, not really a mandate, but all insurance companies are paying for it to have a yearly screening CT. The low dose part comes in terms of radiation. Every single X-ray, every single CT we do, there is radiation involved. Radiation, which is one of the other risk factors for later development of other kinds of cancer, including lung cancer. So the low dose is a lower dose of radiation, as the term suggests.
Yeah.
So the purpose, look for early appearance, early X-ray or CT appearance of lung cancer. Not every nodule is indicative of early stage lung cancer. And I want to make that very clear because people understandably get very, very concerned when somebody, a physician or somebody, tells them that they have a lung nodule. The vast majority of lung nodules are benign. And a nodule basically means some small particle is inhaled. Then the lung's defensive cells gather around it to contain it. Everybody dies in the so-called huddle, if you would. And that becomes the center for development of scar tissue around it. It may get to somewhat larger sizes, but think of it as like a pea of different sizes that sits in the lung. And when you do an X-ray or CT, you see that shadow. But following that is the key. If there's enlargement, that's when you start thinking of lung cancer. Not every lung nodule requires a biopsy. Those are reserved for enlarging lung nodules, and when they get to a certain size. Tiny little nodules you cannot biopsy. But that's the key to preventing or picking up early lung cancer.
And the low-dose CTs are available at IRMC.
That is correct. We have a comprehensive program for that. And yes, people need not go anywhere else to have those done.
Well, let's talk about that a little bit and the program that is in place at IRMC for diagnosing, detecting lung cancer, and then the steps forward in treating lung cancer. Obviously, the earlier the detection, the better your chance.
So I'm glad you asked that. Yes, we do have a comprehensive program, and the program has a few different parts of it. The first one, of course, is referral, and that's one of the key ones that people knowing, healthcare providers particularly, and we are very fortunate. We have a very smart community of healthcare providers. So first thing is referring for that. Second is we have the capability of doing low-dose screening CT. And then that is reviewed by the radiologist and also by the pulmonologists. After that, they're followed either in the primary care physician's office, which is absolutely perfectly appropriate. Not everyone necessarily has to be sent to the pulmonologist. We are in the process of developing a lung nodule clinic. It was running for a little bit, but we've had some issues with that, but there's every intention of bringing it back. There, when you see an enlarging lung nodule, there are a few different options. Biopsies can be done one of a few different ways. But the key thing there is that we now have no need to refer people out to the community. We have a group of thoracic surgeons who are primarily based at Excella, but they are employed by IRMC now, and biopsies, surgery, anything that's needed to be done with it, that can be done. Then we also have a very comprehensive oncology or cancer program, both medical, where you get chemo, and radiation. And these are top-notch in cooperation with the Hillman Cancer Center, that is UPMC.
Yeah. A couple of moments ago you mentioned, and you said you would come back to it, 20-pack.
Yeah, so 20-pack, the pack year is, for instance, a person smokes 1 pack a day for 20 years. That's 20 pack years. A half a pack a day for 20 years is 10 pack years. That would have to be 40 years.
Okay.
Or 2 packs a day for 10 years is 20 pack years.
Yeah, simple math.
Simple math.
Yeah.
Not that I'm good at it, but this much I understand.
But one of the things that comes out about that and stands out about that is people have to be honest with themselves. And sometimes that's a little difficult.
So, great point. Maybe it's like the principal asking a question and you really don't want to give the entire truth because you're afraid of getting in trouble. So when somebody comes to the office and you ask them, and I love this answer. Do you smoke? No. When did you quit? Yesterday.
So technically.
But we the physicians, we don't and should not have sort of a strict approach to this. Everyone is human. No one lives a perfect life. And just questioning it a little further and being benign in the approach so that you can be a partner in their efforts to quit smoking.
Yeah, we're talking with Dr. Imran Bajwa this morning. I only have a couple of minutes left. These things go so quickly when we get into some of these topics. We've been talking about lung cancer, but there are other reasons people would need to see a pulmonologist, correct?
Correct. Many, many reasons.
Yeah.
Just a few of the more common ones: cough, shortness of breath, again, abnormal x-rays. So you may say, well, my life as a pulmonologist is extremely simple because I just see these 3 things. Well, there are a gazillion causes of being short of breath. There are also similarly a lot of causes for cough and also for abnormal CT and x-rays.
Yeah. By the way, IRMC does offer as well Smoke Free for Life. It's a program they've had in place for quite some time, right?
Thank you so much for mentioning that, Todd. Yes, absolutely. And that is a crucial part of our lung screening program.
Yeah. Smoke Free for Life, I think the next class of that will be beginning in October, I believe. So there's time for people to get in on it.
Exactly. And I would encourage as many people as can. Again, no one there is judging them. Yeah. It's all about people getting better.
Yeah. So information, we really need information here. How do we get involved with IRMC in terms of Smoke Free for Life or in terms of seeing a pulmonologist? Obviously, you said it starts with your primary care and a referral. That would be a good place to start. Is that the only way to start, though?
No, that's not. Self-referral is absolutely perfectly fine.
Okay, good. Yeah. So you just need to contact IRMC?
So you can contact the IRMC main number. I myself am a private practitioner, but my entire career here has been working in and with the hospital. So I have a separate number, but that doesn't mean anything. Calling the main hospital number will get them to the place they need to go.
Yes. All right, lung cancer. There you go. Boys and girls, if you've been smoking for a number of years or if you just started smoking, it doesn't matter your age. It's something you need to be concerned about. It's something you need to be thinking about. Lung cancer and its very devastating effects. Dr. Imran Bajwa, thanks so much for the visit. We appreciate it.
Certainly. My pleasure.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Jake is in the newsroom. He's coming up a couple of moments away from now. Right now, the CBS Sports Minute.
This is Carl Dukes with the CBS Sports Minute, sponsored by FanDuel Sportsbook. Make every moment more. The college football polls are out, and Georgia #1, Michigan 2. Ohio State, Alabama, and LSU are all in the top 5. It's just a starting point for us, but let's not get it twisted. Michigan will be good as well as the Buckeyes. And if you think Nick Saban